You're listening to Nursing Survival. Today's episode is about diverticulitis. Hey, future nurses, welcome to Nursing Survival. I'm Nurse Camille. If this is your first time listening, then thanks for coming. This podcast reviews all the important information about medical conditions specifically for nurses. This will help you in nursing school, for the NCLEX, as well out in the real world. You can find the study guide that goes along with this episode on nursingsurvival.com. I have created several guides that can help you really understand the information. New episodes come out weekly, so add me to your favorites. You can also follow me on Twitter, Facebook, or Instagram. Let's start studying. Diverticulitis is inflammation or infection of small pouches of the intestines called diverticula. Diverticula or diverticulose is a term for these small pouches. When they become infected, the term is diverticulitis. The most common location is at the end of the descending colon and the sigmoid colon. However, they can be formed anywhere in the small or large intestines. Often the cause of diverticulitis is unknown. Some people are just more prone to getting it. Diverticulitis can be caused by an increased pressure in the intestines due to constipation from a low-fiber diet, aging, poor fluid intake, etc. Diet can play a large role in developing diverticulitis. Low-fiber foods and high-processed foods can contribute to it. Risk factors associated with diverticulitis include age, obesity, hypertension, smoking tobacco, immunosuppression, and weakness of the intestines. Some medications may also increase your risk of developing diverticulitis. Steroids, opioids, and NSAIDs have all been linked. A person may be genetically predisposed to getting it. Diagnosing diverticulitis includes both non-invasive and invasive procedures. Computerized tomography, or CT scans, use computerized imaging and X-rays to visualize inside the body. It allows the medical team to view the intestines and the surrounding organs. A colonoscopy is an invasive procedure in which a flexible colonoscope is inserted into the rectum. It allows the medical provider to visualize the large intestines and sometimes the distal portion of the small intestines. The patient will need to prep before the procedure. This includes taking laxatives 24 hours before the procedure to clear out the intestines. The patient will need to be NPO 8 to 12 hours before the colonoscopy. If the patient does not sufficiently prepare, then the provider may not be able to perform the procedure. The patient will be positioned on their left side with their knees flexed. Usually the patient will be sedated, but it can be done without anesthesia. A colonoscopy is contraindicated for people who have bleeding disorders, pregnant women who are near term, and a patient who has had recent abdominal surgery. Symptoms of diverticulitis include abdominal cramping. It is usually on the left side of the abdomen and may go away after passing gas or having a bowel movement. The abdomen may be tender to the touch. The patient may notice hematochezia, which is bright red blood in the stool. They may experience fever, chills, nausea, vomiting, or bloating. Constipation is often associated with diverticulitis, or the patient might have thin stools. Treatment of diverticulitis depends on the severity of the condition. For severe diverticulitis, the patient may need surgery. A bowel resection is a procedure in which the affected intestines are removed and the healthy portions are connected. A bowel resection may be done laparoscopically. Another procedure for severe diverticulitis is a colostomy. A colostomy is a procedure in which a stoma is created for an alternative output for stool. A stoma is created by bringing a healthy portion of the intestines to the surface of the abdomen. Stool is diverted out of the stoma into a bag worn on the patient's abdomen. The portion of the intestines vary from patient to patient depending on where the issue is. The section of the intestines also influences the consistency of the stool. A colostomy may be temporary or permanent. A colostomy can allow the bowels to rest and heal. Drainage of an abscess is another procedure that may be done for a patient with diverticulitis. It may be done laparoscopically. A drain may need to be placed for an extended period of time to help with drainage. Antibiotics are a common treatment for both severe and mild diverticulitis. Treatment of mild diverticulitis may include bowel rest. This includes IV fluids and no food or drinks. When a diet is resumed, it is usually started with liquids or low-bulk foods such as broth, cooked vegetables, and fruit. The patient should be advised to avoid some foods such as dairy products and high-fat foods. Antispasmodic medications are used to treat the abdominal pain and cramping due to bowel spasms. Some examples include dicyclomine, atropine, and propanthyline. The common side effects of these medications is dry mouth. Complications of diverticulitis can be quite severe. A bowel obstruction is a blockage that can prevent food and fluids from passing through the intestines. Symptoms include constipation, thin stools, abdominal swelling or bloating, abdominal pain, nausea, and vomiting. An abdominal obstruction can be caused by scarring or swelling. Another complication is an abscess. It is a collection of pus that can develop in the bowels. Peritonitis occurs when the infected diverticula rupture and the infected contents go through the intestinal wall into the abdominal cavity. It is a medical emergency. Another complication is scarring. Scarring can lead to strictures or blockages in the intestines. A fistula occurs when the infected diverticula form a connection with the surrounding organ or organs. It often occurs with the large intestines in the bladder, large intestines in the skin, or the large intestines in the vagina. Some patients may also experience severe blood loss that can be life-threatening. Nursing considerations for diverticulitis include ensuring that the patient understands the disease process, treatment, and procedures. Diverticulosis is a benign condition that might not cause any complications to the patient. They may have no symptoms until a complication develops. Remember that diverticulitis is the infected diverticula. If your patient has a colostomy, then the stoma should be assessed. Stomas should be red and moist and are normally round to oval. It should be measured for the first 4 to 6 weeks after surgery. Post-operative edema will slowly resolve. The appliance is cut to fit the stoma, so it will change as the stoma shrinks. Other nursing considerations for the stoma include inspecting the surrounding skin for irritation or breakdown. Frequent appliance changes can damage the surrounding skin. Patients often have difficulty adjusting to their new body. You may see questions about disturbed body image. Encourage your patient to participate in appliance changes, to touch the stoma, and to look at it. A colonoscopy may be contraindicated if the patient has acute diverticulitis due to the risk of injury to the intestines. The patient may need TPN, or total parenteral nutrition, if the patient cannot take in food for an extended period of time. Total parenteral nutrition is used when enteral feeding is contraindicated. Blockages and obstruction would interfere with enteral feeding. TPN has many complications and side effects, including risk for infection, fluid overload, and either hypo or hyperglycemia. TPN is given through a large central IV that has its own risk and complications. The patient may need a low-fiber diet in order to allow the bowels to rest. They may also need IV fluids. Patient education involves lifestyle modifications, medications, and procedures. Diet modification includes instructing the patient to incorporate high-fiber foods into their diet. Constipation contributes to diverticulitis. Educate your patient on prevention. They may need to take laxatives, stool softeners, or drink prune juice. Other diet changes include eating foods such as fruit, vegetables, and whole grains. Encourage your patient to drink 8 glasses of water daily. Also inform them to eat low-fat foods. Nuts, seeds, and corn increase the risk of developing diverticulitis. It's pretty common on test. A surgical procedure, such as a colonoscopy or a bowel resection, will require more patient education. Most procedures that involve the bowels will require bowel prep. The day before the procedure, the patient will need to take laxatives until they have clear stools. They should also be informed to only drink clear liquids the day before. They will need to be NPO 8 to 12 hours before the procedure. Before the procedure, verify that the patient has signed informed consent. The patient may need to be placed under sedation during the procedure. Continuous O2 monitoring should be done the entire time. For a colonoscopy, the patient will be placed on their left side with their knees flexed. After the procedure, monitor vital signs. They will need family or friends available for transportation. Thank you for listening to this episode of Nursing Survival. Find me at nursingsurvival.com for more study guides. I have fill-in-the-blank and even coloring pages. You can find me on Twitter, Facebook, or Instagram. I'd love to hear from you. Please send me any topics you'd like to hear. Thank you.